everybody, and welcome back to episode 27 of CCA's Medical Minute Podcast, sponsored by Kroger Health. Wanted to mention, as of this morning, we had about, I guess, somewhere close to 450 subscribers, I think. At least I hope, since we're doing this a few days in advance. But our next milestone is we want to hit 500, and we want to do that by June. So we'll get there. Yeah, my colleague, Sherry Hughes, sitting to my left, is actually been charged with that as a responsibility.
Yeah, so come through.
That's right. That's right. So we'll start this podcast out with a little bit of a graduation announcement. So Sherry is almost a 3-year cancer survivor.
Yeah, almost. We'll be in 3 years.
Okay.
Will be July 30th.
Okay,
will be my
so we're close.
Year anniversary.
Yeah. So she's breast cancer survivor, and so you kind of your actual treatments themselves. What I mean by that is kind of chemo, radiation, that kind of thing. Those have been done a little while, but this past week, or I guess it's coming up on 2 weeks ago now, you completed your medication as well.
Yes, I did. I completed a whole year of Nerlink's treatment, which is a breast cancer treatment for HER2-positive breast cancer that reduces the chance of recurrence. So nice. I completed a whole year of that, which is great.
So is there now is there anything that you have to do, or you just?
No, right now I just have to eat really well. We're going to bring Taylor in on that conversation. Eat well, drink lots of water, keep myself healthy, fit, and exercise and all that kind of stuff.
Water always comes up, doesn't it? So anyway, yes, we're really excited because this is our first time with a guest from Kroger Health. So we do have Taylor Newman in today. And so tell me your title again. I think I have it, but just to be sure. Things do change. So.
So my name is Taylor Newman, and I'm a Nutrition Program Development Manager at Kroger Health.
There we go. All right, sounds good.
It's a mouthful.
Yeah. But you're going to talk about all things health and nutrition and kind of help our listeners and our viewers kind of get on track with not only foods that I think will be good for cancer survivors like myself and also Steve, but for really the general population.
Yeah.
Right.
No, that's true. And so we did actually announce the partnership, I think, coming up on it a couple of weeks ago, but we're really, really excited about this because it's a great opportunity to partner with not only an iconic local brand like Kroger, but to use your reach. I mean, and so, we take intense pride in what we do here. We believe that we're improving people's lives, that we're changing outcomes, improving outcomes with the services we provide here. But it's difficult, when you're small. And so to be able to leverage a partner of Kroger Health size and try to get our message out, it's a really, really exciting development for us. And so really appreciate you guys being part of it and for being here with us today. So, and plus I think it'll be good for, you guys have 22,000 plus associates just in Kroger Health, which is kind of incredible. And I think the bulk of those are in Cincinnati, correct?
Yeah, we're headquartered in Cincinnati.
Okay. Yeah. And so a lot of those employees, I mean, in the unfortunate circumstance that they may be diagnosed with cancer, but they can leverage our services as well.
Definitely.
So I think it'll be really great partnership. So anyway, Sherry, why don't you take over here?
Well, you know what, Taylor, you're a part of a team that is developing Kroger's Food as Medicine program. That's a very important program. It's already yielding important health benefits for just millions of Kroger customers across the U.S. And we want to hear more about what that program entails and, how healthy living and healthy eating and nutrition and all that plays a role in the program.
Yeah. So for those who are not aware of what Kroger Health is, just do some level setting. So Kroger Health is the healthcare arm of Kroger. So I always describe it as if you have gone into a Kroger store and filled a prescription, you have interacted with Kroger Health. Yep. So we've got pharmacy services, but we also have the Food as Medicine team, which, as you mentioned, is where I fit in. So I'm a registered dietitian. And Kroger really values nutrition and the role of nutrition in health. So our Food as Medicine is really founded in the belief of a dedicated, educated, personalized approach to eating and enjoying food so that people can live healthier lives and prevent illness before it starts. So that's kind of where all of our products and services related to Food as Medicine are founded in.
Are you into teaching this to some of your, Kroger customers and in various means? And if so, how are you getting that message across to those customers?
Yeah, so I think a really great part about being a part of the Kroger team is that we do have that face-to-face opportunity with customers to talk about things like nutrition. So one of the main ways that we are sharing and spreading the word about food as medicine is through one-on-one video chats with our registered dietitians. So it's called telenutrition. It's like any other kind of telehealth service. So you'll have a one-on-one consultation with a dietitian, and you come to us with any and all nutrition questions. Maybe you have a diet-related disease. Maybe you have cancer. And you work with a dietitian for personalized nutrition advice.
Now, wait a minute. So this is available to who?
It's available to everyone.
Really?
Yes. So you can sign up.
Yeah. And I know you guys have been working to help with, there are lots of areas that have considered food deserts, and you're trying to make sure that everyone is getting this message and that people are learning how to eat and use the foods that they're eating to be medicinal, if you will, to give the best benefits.
Yeah. I think you bring up a really great point about food deserts, and that what we're trying to do by expanding access to nutrition care and helping people eat healthier, it's really challenging, and people are experiencing a lot of difficulties in doing that, whether it's budget, maybe it's access. Nutrition can also be really confusing. Yeah. So I think that one-on-one connection with the dietitian, dietitians are the nation's experts in nutrition. So that's definitely a great way to clear up any kind of confusion and address barriers.
So then if we had, not to put you on the spot, but so if we had a patient here that was concerned and did want to improve their lifestyle and their health and what they're eating, I mean, we could refer them to have a conversation with one of your dietitians?
Yes.
We just learned something there.
Yeah. And like you said, it's in line with what we do here at CCA.
Yeah. Now, I will tell you, you did talk about eating and enjoying before, and I will tell you that I did eat and enjoy the Skyline three-way that I had before you arrived.
And look,
so
Skyline is great food.
Yeah, if you hear any sloshing around, it's probably the digestion process of a three-way. But so this is fitting together really, really well because we don't talk about this often. We have great content here. We don't often talk about what our mission is at CCA, but it really is to reduce, and this is, Dr. Barrett uses this phrase all the time, but it's to reduce the suffering and the mortality that accompanies a cancer diagnosis. And then kind of a related and second mission/goal is to make Cincinnati the best city in the country to be in if you have to be diagnosed with cancer. So this, like even something as simple as what we just learned, which is that we can refer our patients on to Kroger dietitian. I didn't know that. And that's another feather in our cap too to be able to do that. So it's really, really great. And the other thing is too is that we're in a unique position as we think through. We've built a really dynamic, really, really good marketing team, and when you have a really good marketing team, you want to do two things. You want to be part of increasing the size of the market and increasing your market share. We're unique. We want to decrease the size of the market, but still increase our market share. So we want to see more. We want to see more people because we selfishly believe that we improve outcomes here, based on the time that we spend with people. But ultimately, our goal is less people having cancer.
Yeah,
so
exactly.
that's where the prevention part of this comes in. And so maybe you can even help someone like me actually eat healthy foods and drink lots of water. That's all said and done.
And so, Taylor, with what Steve is saying is so important. We're trying to help better outcomes for the patients here. And we are small, but as we partner with you all in Kroger Health, we get to not only get the message out, but we get to do things like this. Talk not just about cancer and the actual treatments that which we talk a lot about, on symptoms of things of that nature, but we're here to talk about healing foods even today. And having you here, talk to us about some of those foods and some of the categories of food that are really beneficial to people like myself and Steve as cancer survivors, but also the people that are watching this podcast now or listening that can help improve their lives.
Yeah, great question. As a dietitian, I always take a very balanced approach. So I think that any balanced diet that is incorporating a variety of healthful options is going to be great. But specifically, some foods can be really health promoting, including fruits and vegetables. It seems like the obvious choice, but 9 out of 10 Americans do not consume the recommended amount of produce. So I think that's a great place to start. Yep. They've got antioxidants, really a lot of vitamins and minerals. So great choice, fruits and vegetables. Another great food group would be whole grains. So whole grains are going to be unprocessed grains. They've got fiber, phytochemicals. So think oatmeal, whole grain bread, whole grain wraps. There's a variety of ways to incorporate them in your diet.
So, Tara, one thing, and we'll probably need another episode to get into this, to be quite honest, but there is the perception, whether it's true or not, that eating more healthy foods like that is more expensive. Would you generally agree with that, or is that not necessarily the case?
I think that, yes, I think generally that is also what I have read in the literature and what I've heard just anecdotally from when I've been working in the community. Healthier items, whether or not they are actually more expensive, they're perceived to be more expensive,
right.
which can be just as much of a barrier.
Right.
And so on that note, I think there are some more budget-friendly healthful options. Like if you think fruits and vegetables, people sometimes think that, fresh is the way I have to eat. But canned and frozen are just as healthful. You can read the nutrition facts label and you just want to watch for sodium or added sugar. But other than that, you can find plenty of healthful options that can meet any budget. And working with a dietitian, especially a retail dietitian with like really clear product knowledge, can help you navigate those choices.
And so
Yeah.
I apologize.
No. I was just, when she
steal
said different
time.
sugar, limiting sugar and things like that, I just heard someone say the other day, sugar is definitely no friend to cancer because it may have, some effects where it is helping cancer to spread. And I don't know if that's necessarily true, but I guess making sure that you lower sugar intake is beneficial.
Yes, definitely. Just for general health, you want to consume less added sugar, still part of a healthful diet, but just in moderation.
That's why I always try to eat donuts before 10 a.m.
It doesn't count before 10 a.m.
That's right, exactly. So this is really interesting. So I want to tie one more question to that. So let's say, for example, I want to place a priority on eating healthy foods, but I really have to be sensitive to my budget. Can I have that conversation with a Kroger dietitian?
Absolutely.
Okay.
Please do.
So they can kind of take that into account. Like, I can't really afford to buy organic produce all the time.
Yes.
That's really, really great.
Yeah. And you name it, we work with you on how to shop throughout the grocery store with budget in mind, how to utilize. Kroger has all these other services like we've got coupons and pickup and delivery. So we help you navigate all of that to kind of triage you getting what you need within your budget.
Okay.
And to wrap this all up, as a cancer survivor, if someone's out there that's newly diagnosed with cancer and they need to get some better nutrition information and foods to eat, and they are a Kroger shopper, can they just go in and say, who can help me put together some type of a menu or put together a list of better foods to eat that can help me while I'm going through even, say, chemo?
Yeah. So normally when people are going to meet with our dietitian, since it is telenutrition, they'll sign up online at kroger.com/telenutrition.
Okay.
Just enter all your information and we'll get you an appointment.
That's awesome. Yeah.
This is great. I mean, this is really, really great. So I'm really glad you came out today. We're going to do another episode. We'll give you a little bit of time to think about what the next set of messaging is that you want to get out. But if I will just say for myself, learning what you just told us is really huge because we're going to be putting together a wellness guide this fall. We're going to ask for your participation in that as well because of the importance of it. And so that'll be something we'll be giving to our patients and things like that. So to be able to incorporate that into that wellness guide, I think will be really huge. And we didn't know about that. So.
And before we let them go, in addition to the wellness guide, we will have genetic counseling now here at CCA as well.
Yep.
Precision Oncology.
Yeah. So in fact, that's a new development here. But yeah. So kind of what we're talking about here is I would kind of view more on the prevention side, but. Precision Oncology allows people to get after cancer at earlier stages and provides better outcomes as well. And so we just brought in a new gentleman that's going to be running that program for us. So just a lot of exciting things we're going to be able to do in the coming years, and also with help from an organization like yourself. So really appreciate you coming out today.
Of course.
We'll plan on doing another one when we can get into this a little bit more. But we really wanted to introduce everybody to Kroger Health today and talk about our partnership because it's going to be really, really great. So thanks, everybody, for joining us this week. We'll be back next week, Wednesday at noon, as always. And, who knows, by then maybe we'll have 500 subscribers.
That's right.
So anyway, take care, everybody. Thanks again, Taylor. I really appreciate it. We'll see you soon.
Like and share.